Okay, Janet, today is, oh my gosh, today is the 29th? Am I correct on that? Yeah, 29th. Okay. Okay, today's the April 29th, 2011, and this is the day after your third and final ketamine infusion, okay? And first of all, I want to talk a little bit about how things went during the infusion, okay? One of our biggest challenges with you is what I call lower abdominal burning pain, okay? And it seemed like it correlated with the administration of ketamine, okay? And the way we treated with that is somewhat paradoxical. What we did is we actually increased the dose of ketamine to knock you out, so to speak, okay? But in addition to that, Versed seemed to help you, you know,
Yes,
getting that up.
Definitely.
Yeah, definitely. And also, the last day, we did one more thing because you were still having some issues there. We gave you some Robenal. Robenal is a drying agent. It keeps, it counteracts some of the effects, but not all the effects of ketamine, okay? So that seemed, it seemed like things really were best for you that third day. Do you agree with
Yes,
me?
definitely.
The third infusion. Okay. You had no bad hallucinations. Your vital signs were extremely stable. You're a fantastic breather. You're a very good patient because Jim here, when he said take a deep breath, you just jumped right on it. Right, Jim? He was very cooperative. Now, we got you up to 200 milligrams an hour, right?
Mm-hmm.
And the only thing that limited us here with you was we would get you into deep anesthesia. We just showed you a little while ago a clip of where you had trouble, you know.
Responding.
No, you couldn't. You didn't know who your husband was, or what his name was. Remember that?
30 years, sorry. All it takes is a little ketamine.
But you knew what state you lived in, right? Anyway. So, and we do that just so you have an idea what it's like when you do get an adequate dose, so when your brain is really doing what we want it to do, and that is to be rebooted. Okay, now, we're going to go through these exercises we did at the beginning and see what progress, if any, we made with you, okay? So let's start with the vertical finger test. Take your hand, probably your left will be easier for you. Look straight ahead, and put two fingers, vertical fingers in your mouth, please. Atta girl. Good job. Any pain when you do that?
No.
Good. Okay, next thing we had you do is we had you lift your right hand up and see how far you can get it without getting yourself into severe pain. All right, there you go. Now, is what's limiting you from going any higher than that?
It's stiff.
It's stiff. There's no pain.
Yeah.
Okay. So, and we talked about earlier about how the heated pull exercises can improve on that range of motion, which is critical in your situation, because as we know, the shoulders are very, very sensitive to getting frozen. Okay. And okay, so so that's important. The next thing we want you to do now is to go ahead and do the same thing with your opposite. Make sure you're still okay there. No problems there. Okay, good. The next thing we want you to do is take that right hand out in front of you, please, and open and close it using your thumb. You're much faster there, aren't you?
Yeah.
Less stiff.
And there's no pain.
And there's no pain,
It's just
right?
stiff.
And before there was pain when you did that.
Oh, yeah.
Okay. And now you remember you had pain in that left hand. Remember that?
Mm-hmm.
Go ahead and take that one out there. Open and close it. You have any pain now?
No pain.
Okay, good. All right. The next thing we want to do here is you might remember I marked you out earlier today, so we have the same marks down here on your wrist. Remember, now I want you to start up here with your left. Start up here and just work your way down. Stop when you get into the area that has the allodynia.
Yeah,
And it's like a little circle there, isn't it?
Yeah, everything else is
It's
fine.
all shrink. Your fingers,
fine, this
your
is
finger.
fine.
Yeah, right.
Yeah, it's just this little tiny area.
Right.
So that's a drastic improvement.
You're right, and that's important because now you can hold things and and not drop them. And
Yeah,
I
I
forgot
can touch.
you are right-handed, aren't you?
Yes.
Yeah. You have a kind of a normal sense of touch. That you can feel things. Right.
Doesn't feel like it's covered in wax anymore.
Like right. Exactly. Okay, now the next thing I want you to do now is once you get up and I'm sorry, get your ankle off on the right side. Rotate it. Go ahead and wiggle your toes. And hitchhike back southward. Okay, very good. Over there, the other side, please. Rotate. Wiggle your toes. Okay, good. Hitchhike on back to Boca Raton area, I guess is where. Is that right?
West Palm.
West Palm, sorry. Okay, go ahead and stand over here, please. Okay, now we're going to have you take 3 steps toward me, please. And 3 steps back, please. Good. Now, if I recall correctly, you didn't have any issues with that when you did it. You did have some issues, however, when you tried to walk on your toes. Remember that? So I want you to try to walk on your toes now. 3 steps forward and 3 steps back on your toes, please. That a girl. There you go. Now remember, I want to let you stand there for a minute, because remember what happened with you is you didn't have the burning pain right away. It sort of creeped in after you got done with the exercise. Do you remember that?
Yes.
Is it creeping back in now?
Like a rush of pain.
Like a rush of pain.
Yeah, before I was like holding up my toes. I didn't want any.
Right, and it was a burning sensation on the sole of your foot. Am I correct on that?
Well, on the toes.
On the toes,
Yeah.
right. but you're not having that residual anymore.
Nothing.
Okay, and just so you know, there's a term for that in case you run across, called hyperpathia. When you stimulate, you may not feel it initially, but you get this late delayed onset of usually a burning type sensation. Okay, all right, now go ahead and do your heels, please. You're able to do your heels before, and did have some problems there, but I don't think that was as bad as your toe. That wasn't as bad as your toes.
No.
You want to comment about your heels?
There's no pain. Again, like last time, I wanted to get off my feet as soon as possible, and
Right.
there's nothing. It's
All right,
not
so
burning.
all right, so we have one more test. Can you move that chair towards you? This is just one last test we're going to do, see how well you really did do. Okay, do you see that stretcher over there
The stretcher,
with the black? With the black thing on top. Right there, that thing. You see that?
the
Okay.
bat.
Yeah. Here's what I want you to do. I want you to leap from there over to there. Can you do that?
You do it first. You show me.
Oh, yeah. I think you're on to me, Janna. Okay, go ahead and sit down. Okay. All right. Okay, so let's go over a couple things here. And some of this we've already discussed, but I want to get it on the record, okay? About where do we go from here in improving without ketamine, okay? So we talked about the heated pull exercises, right? That's absolutely critical to your rehabilitation. Critical.
We'd already been in one pool, and it was amazing.
Yeah, good. So here's why, and I'm going to just summarize for you. Point number one, you need the buoyancy. There's only so much you can do to improve on your feet, and you're not going to make very much progress. In fact, you may get what we call bad hangovers by trying to do exercises with your feet, because all that weight-bearing issues. And also, you got to be gentle on that shoulder. You got to make progress with your shoulder, but you can't end up with bad hangovers, overdoing it. And absolutely, unequivocally, never ever have anybody do any passive manipulation on you. And I think it's a good idea to stay away from massage, because it's too dangerous. Somebody's going to get a little carried away with that, and all of a sudden they're pushing your shoulder out of whack. Okay, and it's just too dangerous. So you do it, but nobody else does it. Okay, they can cheerlead you along, but not.
With the torn rotator cuff surgery, I'm now on 9 weeks on Monday. And normally they stretch it to get it higher and higher.
Tell them no.
I can do that on
Tell them it's malpractice as far as I'm concerned, okay? And as a matter of fact, if you go to our website, it very clearly states that no passive manipulation is absolutely contraindicated in you people. And there's many patients that have ended up really in serious
trouble. Even though I'm still recovering from.
Even though you're not ready for that, no. And you should never have passive. You should be doing all the work, okay? And as you can. Okay, the second thing is the water is a very potent desensitizer. I would expect that to desensitize even that one little residual spot you have there in that right hand, okay? So it's a desensitizer. 3, water is an exercise where you're least likely to re-injure yourself. The biggest cause of relapse in these patients is re-injury, okay? And 4th, water can be a profound stress reliever. As you've learned, stress is your worst enemy. It can really set your RSD off. And there's a technique called Watsu. I believe we talked about that. There's information on our website on that.
Yeah, we perused it.
It's something to look at. It's like icing. Think of it as icing on the cake. Okay. The main thing is to get in the water, but it can be a profound stress reliever. It's a technique, and it requires a partner. He can partner with you on it, and he can get some stress relief from it too.
Stress relief is going to be a little bit difficult being on the 911 operator.
Yeah, well, this is why I'm going to go to my other point I want to make. Sometimes when we get people like you that are either A-types or whatever you want to call it, the kind of people that are in that kind of situation, like whatever you want to, whatever.
911.
Well, yeah, right.
Life or death,
Firework, whatever. You need to get a good clinical psychologist that can help you with some stress management. A good clinical psychologist that works a lot with chronic pain patients, okay? They can be very helpful in giving you some ideas, some techniques you can use to more effectively manage stress.
I'm a
Period.
pretty calm person, so I really didn't think I was under.
Well, you can't be an objective observer of your own stress. I can't. Nobody can. So you need somebody as an outside observer that's trained, experienced, skilled in knowing all about stress management, okay? And you have to be very comfortable with that person, okay? We have 2 of them here in Tampa, but we're not exactly where you're located, okay? But you're going to have to shop around, and one of the techniques that's commonly used that can be very helpful is progressive muscle relaxation techniques. Okay, all right. Now, the next thing we want to talk about is how will you know when you need another ketamine infusion? Okay. Now, you're going to use the opportunity when you're in the water to measure your exercise tolerance. That is the most reliable way in which you can determine if you need another ketamine infusion. There's one word that we want to get out of the caregiver's vocabulary, Okay, it's a 4-letter word. What's that word, Jim?
I just remember that
It's a good thing. It's a good thing this isn't going up on YouTube.
Okay. Again, I wouldn't care.
Huh?
Again, I wouldn't care. But anyway.
No, pain. You don't use that.
Okay.
You don't use the P word. She can use it all she wants because you want to get her focused on function. So when she comes back from her pool exercise, hey, how did it go? How many minutes did you do? And this and that sort of stuff. You want to get, because pain will get. Most CRPS patients cannot really make sense of the pain. They can't, but they can make sense of function. They can use that to gauge how they're doing. Okay. All right. So exercise tolerance, we talked about in the water, you got to decide on some exercise you can halfway enjoy or enjoy. Could be treading water. You just got to figure out what works for you. But the point is you want to measure it. Either in terms of time, in other words, how long you could tread water, or in terms of, you could only walk halfway across the pool with the water up to your waist or something like that. And you want to see week by week if you're making progress, okay? If you're making progress, you don't have to be anxious about having another ketamine infusion. If you're not making progress, and in your case, range of motion, you want to get a video camera and document that maybe once every 1 or 2 months and see if she's making improvements and getting that shoulder fully, what we call abducted, in other words, up over her head, okay? So you want to monitor that. So if you're making that kind of progress, that's a good thing, okay? And you don't have to worry about it. But if you're not, then I think you really ought to think about having another ketamine infusion, okay? And in your case, you've got 2 options, 3 or 4 days. Both are fine. You just got to decide what would work best for you, okay?
I kind of want to point out that before I didn't realize how much pain I was in until it was relieved.
Okay.
It's amazing. I can now recognize between the torn rotator cuff repair and that type of pain and the RSD pain. So
what you're telling me is that by treating the RSD pain, it helps you from a diagnostic standpoint, and that's absolutely correct. And that's what we do as doctors. So we got to get rid of the RSD pain. We can figure out what the hell is going on beneath all that, okay? I also want you to keep track of your lower abdominal pain, okay, and see what happens there. You may be surprised. We may have done something there, but you don't know until if you kind of monitor and keep an eye out for that, okay? Right. Now, I think you mentioned something, and I completely forgot what it was. Something about your hand.
Before I was protecting it, because it hurt. I was, kind of like, don't touch, don't look anything. Right. Now it's like just moving it, touching things, moving it. This is like totally amazing. Yeah. To be able to do this with no pain. Right. It's just the stiffness. Right, exactly. So I think if I work through that, and do the exercises. Now, right. Now, one of the things I want to caution. Finally recover. Right. One of the things I want to caution about. Using the hand and all that is great as long as you're the one that's doing it. But there's one type of exercise I want you to try to avoid, and that's what we call prolonged repetitive movements, like sitting there just doing this all day, or being on a word processor all day. Not taking breaks. And if you have to be on a word processor, get yourself ergonomically settled so that you're not doing a lot of wrist action. Because even in normal people, if you do this enough, what's going to happen? You're going to swell up your wrist and you're going to get a little bit of carpal tunnel in there. Not a good thing. Okay. See, my physical therapist with the shoulder, he gave me a ball. No. He said, bad. You can't do it enough. Bad. No, he's wrong. She or he is wrong. And tell them I said so. Okay. And tell them to stop it. They're going to make patients miserable. And it can actually make them much worse, okay, if they have CRPS. See, the problem is they're trained as physical therapists how to deal with stroke patients, and patients have spinal cord injury, and they just have no experience and understanding of what CRPS is. A totally different ball game, okay? Unfortunately. So I can find somebody in my area that's, is there anybody of your caliber? I don't know of anybody that has experience, but I'm going to tell you, that's why you're going to have to become your own advocate in terms of what you can and cannot do, and you got to be firm about it. Okay, which is going to lead me to the next thing we want to talk about. Oh, okay, so let me ask you a question here. If you go into the water, this is test time. Oh no. See if you learned anything over the last week. Okay, if you get in the water and you come out of the water and you have no pain, is that good or bad? That's bad. Yeah. Why? You want a little bit of pain so that you have a good hangover, not a bad hangover. The bad hangover is like you're hung up all day or a day or two. That's bad.
You've overdone it. Yes.
That's bad. Okay, here's another test question. Okay, I'm gonna put you on the spot here. I love to harass you. He does too. You are with don't you? You love to do that.
Of course. The day's young.
Okay, so here we go. Is there a role for narcotics, and they're called opioids, in treating RSD? Is there a role? Yeah.
I don't think we covered that one. I don't like them.
No, I know we didn't cover it, but so that's why I'm asking you, because I want to make sure, because this is very important.
Is there a role for them?
Yeah.
I don't know. Maybe.
Yes.
Because if you have
Okay,
pain,
let's see if he says yes. He's got the right answer. And let's see if he knows why. Go ahead.
The reason being is because we've got her back to the point where her nerves are backing off. We can probably manage the RSD with these medications to a certain degree.
He's
along
wrong.
with proper rehab.
He's wrong. He's wrong. He's dead wrong. He doesn't know the answer, so that's why we're going to go over
It
this.
sounded good though, didn't I?
No,
Really?
no, Jim, you didn't sound
There's your
good.
patient over here.
He's what
He's like, get the pet test back over here.
Okay. I just wanted to talk. Okay.
Okay, so here's the role. Okay, and it is very, very important. Okay, it's this: the opioids give you very, very, if any, pain relief with a CRP. It's nerve pain. It's not the kind of pain you have when somebody steps on your toe. It's not that. And secondly, it may numb you a little bit, make you a little foggy, and so you don't appreciate the pain as much. But that fogginess, you develop more and more tolerance to it, and you need massive and higher doses. Secondly, you will get constipated, big time.
Right.
Okay, yeah, and your eyes will turn brown. Yep. See, I'm competing with him. See.
I'm impressed.
No, but you can get fecal impactants, which can require surgery. So it's really bad. Now, the other thing about the narcotics that you need to know is that over time, if you use them chronically, they can actually increase your pain. Now, you didn't know that, did you?
No.
That's true. Yeah, we have good studies to back that up. But we said, and I agree with him. He had the right. He's one of these guys got the right answer. Yes, there is a role, and there's a critical role. Let's just say somebody comes up there and you get your hand caught in the door. You know that's going to be very bad news for you. And when we get our hand caught in the door, if it's just a simple soft tissue injury, we can get over it in a few hours. The pain goes down. You know, we whine a little bit, but we're over it. With you, it ain't going to happen that way because you got this phenomenon called hyperpathia. It may last for days and days and days, right? Now, here's the deal. That pain is what we call acute pain. It's totally different. It's not nerve pain. There's chemicals released, substances released, the mechanism is totally different. That pain has to be treated. If it requires narcotics, you have to use them. Whereas he doesn't have to treat it, I don't have to treat it, you have to treat it. You go to the dentist, he starts drilling away, and he says, let me know if you have pain. You say, oh, I don't want to whine. No, and you let him keep going, you're going to set off the RSD. You have to keep yourself out of pain. If it requires narcotics, if it requires the dentist to numb up the whole side of your face, you know, because when they do it here, it does spread, right? You have to have it done. You go into surgery, you get out, you let the doctor know, hey, I got pain, take care of it. If don't, tell him I got a dog down in Tampa or up in Tampa that's I'm gonna sick him on you.
Okay.
So that's a rule. It's very, very important you know that and understand that. Okay? So, and I'll give you a little more subtle one. You decide, all right, so it's Jim's birthday. So you go to the mall, you spend 3 hours, 4 hours there, and you're on your feet. You overdid it. You know you're going to have a bad hangover. But that weight coming down is injury because you're bringing all that weight down onto those feet, right? So that is a good time when you may have to take some narcotic because ibuprofen doesn't handle it. And you may have to take it for 2 or 3 days to get over that. You understand? All right, good. Now, so we covered the medication issue. Now let's turn to Jim over here. Jim, have you noticed any differences here?
Yes. Yesterday at about 3:30 when we left, there was a possibility of us getting together with my son and his wife. And Janna said, I just need to rest. I don't want any company. As the day wore on, 4:30, 4:45, we decided to get up and get about. We ended up going swimming for 45 minutes in a heated pool. So the difference I was seeing is at one point right out of here she wasn't ready to do anything. An hour and a half later she was feeling a little bit more, a little better. She was feeling up to it. We went into the pool. We spent about 45 minutes to an hour in a pool, and I had her move her arms just very gently in the water with slight resistance.
Right.
And she's telling me at that point that she was feeling less pain, that she's able to do something she hasn't been able to do for a while. So I started to see a positive out, after about an hour and a half of being out of here. This morning again, she talked about certain movements she could do without pain, but she had the stiffness, which is understandable because she's
Sure.
been a little bit immobile.
Right.
Because we were going through these treatments. So with that said, I think she's making some great gains.
Right, right. And we can expect, in a realistic way, more gains with the heated pull exercises, okay?
Right.
We also talked about, just for completeness, about the importance maybe once every 2 months or so, getting your little video camera out and run her through, it only takes a couple of minutes, run her through those exercises, okay? Because you got a well-documented picture of what she can and cannot do, and see where she's going, okay? All right?
Sure.
Anything else? Janna, do you have anything else? Anything else you want to add?
Thank you.
Oh, you're welcome.